maybe that's your favorite celebrity. That's the last name you remember. Okay, so memory, is that a bit of a problem for you right now? A bit blurry? Yeah, we can tell. That's okay. And do you know your birthday? April 1st, 2002. That's not your birthday, but I'm gonna write that down. Okay. And do you remember what address you live at? Sesame Street? Is that a joke? Oh no, you're serious. Okay, let me just write that down. Well, I'll tell you right now, you don't live at Sesame Street. And just a quick question, because it does seem that memory appears to be the first thing that I see could be just a bit of a problem here. Going to ask you, were you perhaps participating in any sports and maybe something bumped your head? Maybe you were doing an activity like perhaps on a jump rope or a trampoline, something hit your head. Not that you can recollect at all. Okay, maybe the nurse's reports were right here. So what we're going to be testing today is your cranial nerve exams and going to perform a full head to toe exam, because something just appears to be a bit off here, okay? And trust me, everything cannot be wrong, okay? Sometimes we just have our days, okay? Good. And we're gonna figure that out. No worries. Got it? Good. Do you remember my name? Oh, no. My name is Dr. Brain. Yes, I'm the neurologist here. Okay, we're gonna have to keep you on track with that. Okay? Good. So, let's just start with some basic health exams, such as getting your vitals, okay? Good. If you could please take a seat right at that medical table. It's just like a chair right there in front of me, and just take a seat. Very good. So, I'm just gonna first do something called a head to toe exam, okay? I'm going to ask you just to relax and sit still. And this is a part of a vitals examination. I'm gonna ask you, can you look directly at me? Is that you looking directly at me? Oh goodness. Okay, well there might be something a bit different with your eyes. And I'm just gonna ask you really quickly, can you give me a smile? Okay, well, I'm going to ask you, can you raise your shoulders? Okay, can you raise both of your hands like this? Okay, can you move your hands? Okay, so it's a bit limited right now. And are you able to bend the knee a little bit? As that is as much of a movement that you could move. Okay, and if you could, you do have movement in your feet and your ankles. Can you roll your ankles just like that? Okay, well, I think we have a couple of things to go over today with. Okay, good. So you said that yesterday you started experiencing this type of stuff. Okay, then that means that we have a lot to check out with you today, okay? We're going to be doing a very detailed cranial nerve exam that's going to figure out what's been happening, okay? And first I'm just going to start off by taking your vitals, okay? Your temperature, so just relax and sit still. Okay, one more time. Have you been sick at all for the past 2 weeks, or maybe you're just recovering? No. Well, it does say that your temperature is running at 110 degrees Fahrenheit, which is not good, and it does not necessarily make any sense. I'm gonna try this again. It might just be my machine. Okay, now it says that you are running at 80 degrees Fahrenheit, which is freezing. I'm gonna try a different thermometer here, okay? Yeah. No, I'm not worried. I'm a professional at this. I think we'll be able to figure this out. I was gonna ask you just to say, very good. And we're going to wait. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. And now it says that you are at about 100 you just to sit still. Breathe in and breathe out. Good, just relax. Okay, other side. Don't worry, I'm not shocked at all. Breathe in and breathe out. Breathe in and breathe out. Okay, I'm going to test your back now, where we're going to be feeling and listening to the lungs, okay? Good. So, breathe in and breathe out. Okay, now listening to the lungs. Okay, I'm going to be listening now right there to the thorax. We're going to be listening to the stomach, okay? Just sit there and relax. No sounds at all. None at all. Okay. Well, interesting. I'm just going to quickly write that down. Okay, just gonna write that down. It does look like your heart rate is sporadic, and what I mean by that is that sometimes it is very fast, and at one point I thought I heard it making a song. So we're gonna have to keep a watch on that, and I'm just going to write that down because we might need to just let you rest here for an overnight stay just in case that does happen, because we like to make sure that everything that we do helps and benefits you, okay? Good. And you said that you had not experienced any symptoms of being sick in the past 2 weeks at all. Interesting. Okay. So what I'm going to do now is I'm actually going to take a look at your eyes and right inside your mouth, okay? I'm going to ask you just to say, really carefully. Okay, it does look like you have teeth. Congratulations, that's good. But it does look like that is very interesting. It does look like some of the muscle right there does not appear to be working correctly. Okay, you can relax. Good. I'm going to ask you very carefully, can you mimic my face when I ask you to do something? Just mimic what I do. I'm going to ask you, can you raise your eyebrows very tall, as if you were very excited? Good, I'm just going to put some pressure on your face if that's okay with you. Good. So, raise your eyebrows very tall. And is that as much you can raise your eyebrows? Okay. Let's try your eyes now. Can you close one eye? Oh, okay, wait. I'm going to ask you really carefully. What side is this on? Is this your right or your left? Oh my goodness, looks like your vision is inversed. This is actually the right side and this is actually the left side. Interesting. Well, can you close whatever side this would be for you? Okay, very interesting. And can you close whatever this side would be for you? Okay, very interesting. It does look like the vision's inversed. So can you let me know where my hand is right now? Is this the left or the right? Okay, and over here is left or right? Okay, so it is inversed. Okay, and can you let me know, is this poster behind me, are you able to read it from left to right, or is it backwards for you? Oh, it is forwards for you. Oh, that is interesting. Okay, so it actually is a backwards image. Very peculiar, I would have to say. I'm gonna write that down. I've just never seen that before. Okay, now I'm just going to check your eyes, okay? I'm going to use this right here. I'm going to cover one eye, and I want you to let me know if you're able to see the light from my pen light, okay? Good. And can you see the pen light? Good, and what color is it? Blue. What shape did I just draw? A triangle. That's a circle. Okay, let's try again. What shape did I just draw? A square. That is a rectangle. Okay, I'm just gonna relax then with all the quick eye exams, okay? Let's continue just trying to move and maneuver the face. Can you smile for me, but like a very cheesy smile, like very interesting. It looks like one side appears to be working and the other one isn't. Try again, just like this. Okay, now that's a frown. Okay, now can you give me a very cartoonish frown, like, and that's a smile. Okay, very interesting. It looks like everything happens to be just inversed. It's a bit different than I would have imagined. I'm gonna write this down. Okay, I've just never seen this before. Yeah, especially for a cranial nerve exam. Very interesting. Okay, so what I'm going to do next is I'm actually going to ask you, have you had any problems with your hearing in the past 2 weeks or just in general? Perhaps you are someone who has sensitive ears or something like that. Okay, well this is a model of your ear, okay? What we're going to be doing is I have a couple of something called as a tuning fork, and we're going to test to see if you're able to hear certain sounds, okay? And some of them you should not be able to hear, and some of them you should, okay? And so what's going to happen is the sound actually enters the ear through here, and it's going to just go right through the ear and hit the sound back so you can recognize what it is, okay? So we're going to just test your ears, okay? And I have a couple of tuning forks here, and they're all at different tuning fork settings, if that makes sense. So a tuning fork looks like this. And there should be some that you should not be able to hear and some that you should. And this one happens to be in F major, but a very high key F major that a lot of humans cannot hear. Let me know if you can hear this, okay? Can you hear that? Wow, impressive you can. Okay, let's go and move on to the higher frequency tuning fork. Okay, let's try this. Are you able to hear this one? You are? Okay, that's very interesting. That means that your ears are very sensitive to sound. Is that true? Only recently. Okay, do you listen to really loud music? Okay, and how often would you say you do that? Well, that's not often enough. I'm just gonna write that down. Okay, let's use the normal tuning forks that you should be able to hear. Everyone should be, okay? Let's try this out. So this one happens to be in the chord called C. Let's try it. Can you hear this? None at all. Okay, and let's move it down a scale. And let's move it to a D. Okay, let's try it. And can you hear that? Not at all. Okay. Something is a bit backwards. I'm just gonna write that down here. I'm gonna test your hearing now, okay? I want you to let me know if you hear the sound coming from your left ear or your right ear, okay? Good. I'm gonna put my this one right here. Now this one is an amazing essential oil. Let me know, are you able to smell this one? It smells like oranges. Oranges. Could you let me know what color is this bottle? Orange. Okay, we'll have to test your colors after this as well. This is not orange. This one actually is rose or rose hip. It smells exactly like flowers if you stand right next to them. Interesting. Let's try this one right here. Okay, we have this one right there. Okay, and I'm going to ask you just to carefully smell that and let me know. There are no correct answers, but we're looking for a general proximity and smell that's closest to what we could have imagined, right? And this one also smells like mint. Okay, well, this one is jasmine. It's a floral scent that people make perfumes with. It's very reflective. It's a smell that a lot of people can identify. Yeah. So let's try this one right here. Okay. And what does this one smell like to you? Like a marshmallow. Like a marshmallow. And kind of like s'mores. Okay. This one actually was the closest that you got to a correct answer. This one is chocolate. Definitely not marshmallow though, but it was chocolate, so that was closest. And let's try one last one, okay? This is the last one that we have here. And this one smells amazing. So, I'm going to ask you, what do you smell? Coffee. Immediately, that's it. It's just coffee. Okay. Okay, very interesting. This one actually is the beach, or it's also known as sandalwood. And this one is supposed to like kind of remind you of that beach wood smell, you know? Definitely not what you thought it was. I'm just gonna write that down here. Okay, so I'm just gonna give you now just a quick taste test. I have a solution here that's either very sweet or very sour, and you have to let me know which one it is, okay? So I'm just going to put 2 drops on your tongue. Just say, good, and we're going to have 1 and 2. And now just swish and swoosh, just go. Okay, and what is that? It's very sweet or very sour? That is very sour. Okay, that one is sweet. Okay, I'm just gonna write this down here. No, don't worry. I totally know what I'm doing. I totally know what's going on here. It's just I've never seen a combination of these things before. Yeah. Okay, I'm gonna quickly test your eyes now. This is called the visual proximity test. And afterwards, we're going to test your face. This is to test the muscular structure of your eyes, okay? And let me know which you see better with right now, vision 1, as we are, or visions with these separate lenses, okay? And let me know which do you see better, this 1 or 2? 1 or 2? Okay, 1. And what's the difference between 1 and 2? What's this lens have that the first one does not? The background is focused. Okay, let's try another lens. What's better, lens 1 or lens 2? Lens 1 or lens 2? Lens 2. Okay, and what's different with this one? It looks like I'm focused in like a camera. Okay, that's very interesting. Never seen that before. Let's try the third one. What's better, 1 or 2? 2 is even better. 1 or 2? And what's focused now? I am. Okay. And last one, what's better, 1 or 2? 1 or 2? 2 makes the background focused, but me not so focused. This was actually supposed to be doing the opposite, so each time I progress with the lens, you are actually supposed to see more of the peripheral vision expand, and that is soft and one part that is sharp. I'm gonna ask you to close your eyes, but I want you to let me know which is soft and which is sharp. Okay, good. So close your eyes and you let me know which is sharp and which is soft. Okay, good. So soft or sharp? Sharp. Soft or sharp? Soft. Soft or sharp? Soft. Soft or sharp? Okay, sharp. Interesting. You can open your eyes now. Now I'm just going to quickly test your musculature reflexes, okay? Right here first, I'm just going to ask you to keep your eyes open, okay? And right there in your eyes. No reflex, okay? Below the eye. No reflex, and below this eye. No reflex. Okay, I'm going to ask you to stare directly into this. And 0 reflexes. Interesting. Let's try right there at the jaw. Nothing. Okay, let's test your hand. Could you give me a hand? Good. None. And over here. None. Let's test your knees. Okay. Okay, nothing there. And okay, no reflexes. Okay, so I think I've seen enough today that I think we can just conclude. What's going to happen is I'm going to have you to stay overnight, okay? Right here at the clinic, and we're just going to be seeing how you fare throughout the night, okay? And what's going to happen is we're going to be checking in on you, giving you random cranial nerve exam tests, etc., etc., just to make sure that we are seeing some progress in your health, because as of right now, I've just never seen some of these things before, okay? Yeah, and especially due to a bit of your memory and the things that I have found today, I think it'd be best if we just kept you here just a little bit longer and just examine you a bit more, okay? Yeah, I'm gonna have also a lot of the doctors from here check you out too. Yeah, no, I'm not worried at all. Yeah, no, I'm not worried, so relax. We're gonna have everything set up for you, like, as soon as possible. Yeah, no rush, just relax.